Okay, I think we're all ready to go. Thanks everybody for your patience with some of the technical difficulties. But thank you for making time to join us today. I'm very excited for today's presentation to share some of the key findings and recommendations that have come out through the state of environmental health in PA schools. So I'm going to go ahead and get us started. I'm very excited to talk about this report, and it's a really timely report that we've been working on here at Women for a Healthy Environment for the past 2 years. So just a little bit about the organization. The mission of Women for a Healthy Environment is to educate citizens about environmental risks and advocate for a community where children live, learn, and play without the threat of environmental harm. The Healthy Schools PA is a program of Women for a Healthy Environment, and I am the Healthy Schools PA program manager. I apologize if I forgot to introduce myself. My name is Kara Rubio. And in the Healthy Schools PA program, our focus is to empower parents, students, educators, staff, and administrators to take an active role in creating healthy school environments. And we do this through our 3 pillars of technical assistance. So really taking a look at the learning environment in all its forms and thinking about how that may affect the health of our school communities, the health and learning of school communities, through our educational programming, where we build capacity and build skills so that folks can act on environmental health topics in their school communities, and through policy and advocacy, where we push for investments, necessary investments to create healthy schools for every child. So a little bit about this report. The State of Environmental Health in Pennsylvania Schools is a biannual report. It's the first of its kind that's been put out. And in this report, we take a deep dive into the environmental quality of school facilities across the Commonwealth. The main goal of this report and white paper is to collect information in a consistent manner in order to assess the types of environmental hazards and health risks that exist in public school facilities, and examine the levels at which these schools are taking action through practice or policy, and identifying opportunities to prioritize funding and public health focused investments. So this report is taking a real deep look at what the environmental quality is of the schools across our Commonwealth. And this is the second report of its kind that we are issuing. The first one we put out in 2018 focused on the schools that we serve here in the Southwest Pennsylvania region. But this report that I'm talking about today, this upcoming report, is focused on schools all across the state of Pennsylvania. So I want to take a few minutes to talk about who responded to the report and kind of the process we took to collect data. So all the data that was collected for analysis, or a bulk of the data that was collected for analysis in the report, was taken directly from schools. We used the right to know process to request records of environmental hazards testing and remediation for schools. And when we took a look at the schools who responded, we wanted to know who are they serving? Who's in the building learning, and how those populations in the building may affect the action schools are choosing or are not choosing to take. And so when we were looking at the schools who responded, who ended up in our sample, we found that the average number of students they serve was 2,085, that there is at least 1 school nurse for every 880 students in the building, that the average expenditure per student for the 2017-2018 school year for the average school in our sample was $15,036. And as we go through, you can kind of see these statistics about the student demographics in the building. So when we compared this to the statewide average on PD's portal, we found that our sample was quite representative, which just means that the schools who ended up in our report look a lot and represent schools across the state. So what data did we collect in this report? What are you going to hear about today? So in our right to know request process, we asked for a few specific things. So we asked for records of any environmental hazards testing, and we were looking at these exposures such as radon, lead in drinking water, lead in paint and dust, water quality, indoor air quality and mold, PCBs or polychlorinated biphenyls, We were also trying to do a count of how many synthetic playing surfaces were in our schools and how many natural grass sports fields school districts either leased, owned, or maintained. We were looking at pesticide application policies and contracts, cleaning and disinfecting products being used, actively used inside the buildings, the year that the buildings were built and the year that major renovations occurred in the building. So these are things like replacing a roof, updating an HVAC system, those types of major renovations. We were also looking at asthma rates for students. So how many students in the building had an active asthma diagnosis as reported to the Department of Health in the most recent school year. We were also thankful to get additional sources of data where we were looking at these other factors that we thought were interesting to think about, whether there was a relationship with the learning environment and the environmental health hazards and student health disparities that we were seeing. So we did have data from about point source pollution facilities. So these are facilities that produce toxic waste or that produce pollutants either through the air, through the water, or through their industrial processes that we've been mapping over the past few years and keeping track of. We also looked at school funding data. So this is how much money schools were receiving through bonds, local taxes, state funding, and federal funding. We looked at student asthma data from the Department of Health, and we were able to access student demographic data from the Department of Education as well. So in this report, we'll be focusing on the statewide results that we've seen, but I do want to note that in the upcoming report, we will have sections talking about what changes we've been able to see over time from the first report we put out in 2018 that was focused primarily on Southwest PA schools. And we have this focus, like I mentioned earlier, because this is our primary service area in the state. So these are the schools who we have relationships with and who we've been providing public health programming and technical assistance for over the past 5 years. So getting into the meat of the presentation, what did we find? What is the state of environmental health in PA schools? So the first finding I want to highlight is that Pennsylvania school districts are uniquely vulnerable to environmental health hazards because of aging infrastructure. Simply put, our school buildings are older than the national average. The average Pennsylvania public school building was built in 1964. Now, these ages really matter, not just because old buildings are obvious when you look at them, but because they carry greater risks to the greater risk in terms of structural damage and repair, and a greater likelihood that they contain toxic substances that were not regulated nationally until the 1970s. So you'll see here we have a graphic. The oldest school building in our sample was built in 1908. It has had some major renovations, but as you can tell, schools in this part of the country and really in our state are quite old. And because of their age, they're more likely to have toxic substances in them because things like the Toxic Substances Control Act, the lead and paint rule, these federal rules were not passed until the 1970s, which is a decade, a little bit under a decade after these schools were built. So this is a really important finding that speaks to the unique vulnerability of our public school buildings. Our second finding is that environmental hazards testing reveals environmental health risks, current risks exist in PA schools. So put simply, when we test for environmental hazards in Pennsylvania public school buildings, we find them. Not everyone is testing for all hazards, and not everyone is testing in the same way for each hazard, which has real implications for the types of exposures that students and staff are having when they're inside the building. So in our statewide survey, we found that the most commonly tested for hazard was lead in drinking water, where 89% or 9 in 10 school districts in our sample had tested for lead in drinking water within the past 2 years. The second most commonly tested for hazard was mold. And this was a surprising finding to us because about 7 out of 10 school districts had completed that testing just within the past 2 years. And the most recent date in our sample is pre-COVID, so this does not include all the challenges that our school buildings and our school populations have faced over the past year. So that is important to keep in note that 2018-2019 was the most recent school year included in this report. We also found that schools across the state were testing for other things like water quality, radon, and lead and paint dust in different ways and in different years. Um, and we also wanted to highlight in this finding that although testing does occur in our school districts, it's not always consistent. For instance, if you're testing for mold, some schools only sent results for a single building, a single classroom. And so it's really kind of difficult to compare results because there's a lot of inconsistency across testing for each of these hazards. So another key finding, despite identifying hazards, not all school districts are taking action to remove or remediate the hazards. This simply means that schools may be testing and the testing may confirm that these legacy exposures or chemical exposures are present in the building, that they're detectable in the building. However, their records have not been submitted to show that they've been fixed. So it could be that a school district found, and here you'll see a bar chart comparing the dark green are the percentage of schools who tested who found hazards, and the light green are the percentage of those schools who tested who actually fixed hazards. So you'll see these bars don't match up exactly, right? So there's still a gap between schools who test and fix and schools who test and don't fix. And you'll notice that lead and paint has no schools on record who fixed the hazard. So that means there are a few schools in our sample who confirmed that they had lead paint inside their buildings and did not have any records of removing the paint or remediating it, which is quite a scary finding given all we know about lead poisoning and how lead exposure can be stored in children's bodies and in adult bodies too, and passed down in utero. Another key finding of the report is that although we do have some state policies, so some state laws and regulations that concern the learning environment and how to make it safer and healthier, they're not enforced and they're not uniformly adopted in schools. So we found that most of the schools in our sample, a little bit over 90%, have an IPM policy. So this is an integrated pest management policy. In fact, Pennsylvania was one of the very first states to adopt a policy that required schools to use this process to address pests inside and around the school building. IPM is a way of controlling pests that focuses on it focuses on non-chemical ways to remove pests from buildings and grounds, and it's really focused on prevention. However, despite most of the school districts in the sample having this policy, many of them are still contracting with a pesticide company, which means that they may have a policy on the books, but every few months, the school district is paying some of their maintenance dollars for an external company to come in and spray the building with pesticide chemicals. So although a policy exists, it's not really followed the way it was intended to. In Pennsylvania, we also have an anti-idling policy. So this is a policy that states that heavy diesel vehicles should not idle their engines, keep their engines on, and continue to emit diesel pollution, and that there should be signage. There should be signage on all public school buildings who use a school bus or that type of transportation, that focuses on diesel engines. And although that seems quite a simple law to follow, only half of the schools in our sample actually had reported any signage. And even the schools who did report signage and official policies for anti-idling, not all of them had signage for every school building. So again, an inconsistency in practice. A good finding that we learned from this report, the state does not require an indoor air quality policy for a school to adopt. However, 1 out of 5 school districts in our report actually sent copies over of an internal indoor air quality policy that they had adopted as a district, which is a really positive finding and a great direction for our schools to head, particularly this past school year, thinking about all the stuff that's in our indoor air and the importance of indoor environments on our health. This key finding is unfortunately not, this key finding is really surprising. And speaks to this issue of siting. So the places where we put our schools. Majority of our public school buildings are within a half mile of a pollution facility. So this is a facility that is allowed to emit pollution. So whether they have a special permit to do so, they're producing waste, something in the industrial process creates either air or water pollution. We were able to map a bunch of these types of sites. So these include things like landfills, power plants, air emission plants, coal plants, active coal and industrial mines, brownfields and Superfund sites, and an unconventional gas well, railroads, major roadways, and pipelines. So these are all places that create some sort of emission, some sort of pollution. And we found that it's about 85% of the public school buildings across the state have at least one pollution facility within a half mile. So this is a really striking finding, and you'll see here on the left-hand side that there is a map. The circle with the purple school building inside is every single school that exists in Pennsylvania. These include parochial, private, and charter schools as well. Any physical school building is included on this map. And you'll see that the black icon of a factory with a little smoke coming out, that's just one layer. So that layer is just any site that produces any type of hazardous air pollution. So this is just one layer of a type of pollution, a point source pollution facility that we were mapping over the past few years. And this is taken directly from the EPA's National Emissions Index database. So it's really striking to see this distribution across the state and how close some of these facilities are allowed to build next to our schools. There are currently no laws to protect schools from being a certain number of feet or miles away from these types of facilities. A finding that we want to share today is that when we were looking at who's inside the school buildings, we saw that schools who serve a greater percentage of students who come from low-income families, students who have IEPs, special education students, these are the schools who are less likely to test for environmental hazards. And when these schools do test, they're less likely to remediate the hazards. And this really speaks to an issue of competing priorities. Schools who serve a more diverse population or a population of students who require IEPs or those specialized supports, there's a lot of places for their school dollars to go to. And unfortunately, these schools are the ones who are not prioritizing environmental health in their buildings, understandably. But that just means that the gap between schools who serve really kids in communities that are under-resourced, that they may have deferred maintenance and school buildings that actually are more harmful learning environments because these environmental health issues get ignored. And so it widens the disparities and inequities that we're seeing in the way that the learning environment impacts student learning and academic achievement and student health. So when we're looking at kids who have an active asthma diagnosis, students who have an active asthma diagnosis inside school districts, we found that the school districts who, again, are serving more students from low-income families, more minority students, and more special education students have more students in the building who have asthma. And when we're looking across these other demographic factors, we find that school districts who just in general serve more kids than the average, so who serve more than 2,000 kids in their school district, school districts who have less school nurses for each child in that ratio, and school districts who have older buildings. These are the school communities that are serving kids with greater active asthma diagnosis. And again, that kind of follows what we know about childhood asthma across the state and across the country, that asthma really is a disease of disparities. So it's something that is more prevalent or more present in communities of color and in lower income communities because of different environmental and societal factors. So we're here today to talk to you about what investing in K-12 infrastructure and student health and academic performance looks like. What does it mean to put these dollars into our school buildings to create healthier learning environments? What are the potential gains we can see, not just in student health, but also in student potential and academic performance? So I'm really excited to share this research with folks today, because there are some really striking findings that have come out of really collaborative interdisciplinary research that's happened over the past few years. And so this is bringing together environmental public health researchers with education policy researchers and even economists who are all thinking about how the learning environment really impacts student health and academic performance. So the first study I want to highlight is a study that actually focused on mold remediation. So this happened in the southern state where there is a really strong rainy season and flooding, something that here in Pennsylvania we're experiencing as well. So in this study, public school districts who remediated mold, removed it from the building, sealed the building very tightly, they saw within one school year improved math and reading scores on standardized testing dates. The student probability of passing these tests also increased by 3 to 4%. So with this one-time investment, we were already able to see academic gains in the student population over 1 year. The second study I want to highlight here on the left-hand side shows that air quality and children educational outcomes can be related. And this study had a very simple intervention. So they controlled for a lot of factors. So they were looking at how long the teacher was in the classroom, what the teacher to student ratio is, all these things that we know affect how students do on standardized testing. The only thing that had changed is that the control group stayed the same throughout the school year, and the intervention group, all they got was 1 more liter of fresh air per student per second in their building. So all the building was doing was allowing a greater percentage of outdoor air to come in for the school year. And what we were able to see is that there was a 2.7% increase in reading scores and a 2.9% increase in math scores. And this is a really striking finding because it's not an expensive intervention at all. In fact, it's just increasing the exposure to fresh air for students in the building. And these are some of the academic gains we were able to see within a few months. Some other studies that have come out in recent years are really phenomenal, thinking about the way that we remove those pollution sources from schools and what does that mean for our school communities? What can that look like? So one of the sites that we were able to map in our project are called toxic release inventory sites. So these are sites that have some sort of waste that they create that's toxically released from their facility through their processing or manufacturing operations. So all of these sites need to be registered with the EPA. We pulled the most recent inventory. This phenomenal study was done just a few years ago, I believe in Georgia. And they were looking at what test scores and what student outcomes look like when new toxic release inventory sites open up next to a school. So this study found that a new TRI site opening within 1 mile of a school is associated with approximately 2.4% lower test scores for students in the school. So that's an observational study, right? So they were just watching where these sites were allowed to open to be this close to our schools. And we were seeing test scores and attendance rates, truancy rates. We were seeing all of that being affected within 1 school year. We've also found that a TRI site opening with 1 mile of a school is equivalent to a 2.7 percentage point increase in the likelihood that a school's ranking drops 1 or more levels. And so school ranking is like an interesting educational index. You know, I'm not an education scholar or education policy expert, but ranking can be very important for the amount of support and resources that a school can get. So dropping a few rankings can really change the public perspective of the school, and it can also really materially change the conditions that support a school. And then the last study I wanted to share is a super interesting study that came out just a year ago, and it was thinking about the way that diesel is emitted from school buses. And so, when you're driving behind a school bus, you see some really dark, dirty air that's coming out. That's diesel emission. And this is the reason why almost every state has an anti-idling law that says that these buses can't stay on for longer than 5 minutes because of the amount of pollution they can produce in that time. So this study was really phenomenal because it looked at what happens if we put a $3,000 filter on a school bus fleet. What could that do for a school population? And when you think about drop-off time for your child's school or for the school in which you teach, you'll notice that those buses tend to line up one after the other behind each other. And so just imagine the amount of emission that's being produced on a winter day as the buses are shuffling students in and out. It's a lot of pollution that's being produced really on site at the school grounds. So they found that retrofitting an entire district, these researchers found that retrofitting or adding a filter to a district fleet is really effective. They found an improvement in all of the students, those who had asthma and those who did not have asthma, and the way that their lungs were functioning. They found improvements in standardized testing scores, academic performance, and memorization tests. So just those tests of cognitive ability were able to increase in this school district over the course of the year. And they looked at a bunch of school districts who were prioritized for retrofitting, and the control group was districts who were getting the retrofits later on. So eventually the districts in this whole area were able to see these effects. This is a phenomenal study, and it really gets us thinking about what's possible here in Pennsylvania. What's possible if we put these investments into our schools? Will we also achieve the same gains in student health, attendance, and academic performance? So out of this report, we've come up with a few recommendations, and these are ways that we can really support our schools to be more resilient and to invest in our schools for the long term, so that current generations and future generations of learners and teachers have a healthy environment in which to learn and in which to work. So the first recommendation we have that's come out of this report is we need to create a statewide database for school environmental health data to be collected and reported publicly. Students, parents, teachers, school staff, they all have a right to know about the working conditions of their building. Right now, there's the only environmental health data that's being reported publicly is lead and drinking water testing, which is a result of regulation that was passed a few years ago that encouraged lead and drinking water testing for public school districts. Everything else is hard to find, which is why we as an organization utilize the right to know process. The second recommendation we have is to end the moratorium on PlanCon and fund school infrastructure investments through the general fund. So currently there are no state dollars allocated to public schools to fund capital investments in or school infrastructure projects. There has been some work behind the scenes to update the way PlanCon, which is the way that funds in the past have been funneled for these construction and renovation projects. There has been an update into what projects are considered appropriate for that fund. However, there's been no money in that fund since 2016. And we really need a dedicated way to fund school infrastructure. All of our neighboring states have found a way to do it, and Pennsylvania is one of the few that's alone in not having dedicated sustainable funding for school buildings. The third recommendation is to work with statewide advocates, scholars, practitioners, educators, contractors to create an equitable funding formula for the disbursement of PlanCon and maintenance grant program awards. It takes a huge lift for a school district to do all the paperwork to apply for PlanCon reimbursement. And so we need to be thinking about equity in the way we fund school buildings and in the way that we're supporting moving these resources into school communities who need it most. We need to advocate for safe siting laws to protect schools and their occupants from harmful proximal point sources of pollution. We don't have any laws, like I mentioned earlier, that protects how far away a pollution source needs to be from a school. We have it for residences, but we don't have it for schools. And we need to act on this now, because like I mentioned earlier, we have a lot of aging infrastructure, a lot of older schools. If we take a look at that map again, it's hard to find a place where a school can be a mile away from a pollution facility because we've allowed for so long them to be built so close to where land is cheap. Create evidence-based policies that proactively prevent negative health impacts by eliminating known environmental hazards from the learning environment. So this is just kind of a wordy way to say that when we write policies, we have to have the health of students and school staff in mind. And we have to think about the way schools translate policy into action. There has to be and procedural and financial support for schools to many of whom are doing this for the first time. And so when we write policy, it really needs to think about the school context, and it really needs to think about shifting resources back into those communities so that they can put the policy into action. They can actually practice integrated pest management and work on those really important school health issues. We need to invest in training and professional development for school facility staff, collaborate with academics, practitioners in the space to ensure construction and maintenance best practices are utilized to increase energy efficiency and lifetime use of school facilities. So it's really important that we professionalize all the work that it takes to maintain our school buildings. Over the past year, I think we've really come to see that custodial facilities, maintenance, food service, all school health staff, that they're really foundational to keeping our schools operational and to supporting our families. And so we need to invest in that part of our workforce, and we need to give people opportunities to build capacity to make these decisions within their school environments. Lastly, we need to incorporate resiliency into new construction and renovation standards, noting that school facilities serve as emergency shelters in times of natural and man-made disaster. So when we're building new schools and renovating our schools, we need to keep in mind that we need to build for the future, right? And we need to make these investments, and we need to take in these new standards that we know will make our buildings very strong, will make them very safe, and will make them healthy. So we are at a time right now where we have a once in a lifetime opportunity. If your school district or school is choosing to use some of the American Rescue Plan ESSER funds to do school infrastructure, we have a few places where we'd like to encourage your school make the investment. So just really quickly, the American Rescue Plan was passed in March, and it included a budget for supporting schools for a safe reopening. Within the approved uses of what schools can use that money for, there are lots, right? There's kind of three buckets. So the first is to address learning loss, and that's through supporting summer programming. The second bucket is to build out tech infrastructure for remote learning. And the third bucket is to really assure healthy buildings. And this is the first time we've ever seen a federal investment in buildings since the 1990s. This is the first time we've seen that type of money become available for public school buildings. So the ARP funds have been dispersed through the Pennsylvania Department of Education. Each school district receives an allocation of those funds. If your school district is considering using a portion of those ARP funds to invest in your school facilities, given the data that we found surveying schools across the state, these are Women for a Healthy Environment's 3 recommendations for where you can get the most bang for your buck, so to say. So the first type of investment needs to prioritize deferred maintenance. So for far too long, we haven't been able to do things like change air filters and repair the roof leaks and take out the moldy ceiling tiles. Those are all parts of deferred maintenance that we just haven't had, schools have not had the budget to do for many years. And so our number one suggestion is to prioritize that maintenance backlog and schedule emergency repairs to school buildings. It's not okay for a student to return to school if the roof is leaking. It's not okay for a student or an educator to return to a moldy classroom. We know that when the buildings closed in March 2020, these issues did not go away overnight. And so now that we have the funds to do so, we should address these issues as priority issues. The second is to upgrade the heating, ventilation, and air conditioning systems. We know that the benefits of air conditioning on academic performance are well studied. And so we really need to make an investment to make sure the indoor air is filtered, clean, and fresh, and that there's outdoor air coming into the building. The third is to eliminate existing environmental hazards. We know from news headlines that asbestos, lead, radon, those are things that are common still in our school buildings and should not be. There should be no reason that these preventable exposures are still present in our buildings. So we recommend prioritizing the funds to remove the lead pipes that are there, the lead paint that may still be on the windows, to remove any asbestos that has been disturbed, and to seal the building against radon gas. So that is a good use of money for a long-term investment strategy so that current and future generations of students can benefit from these actions. And I just wanted to end this part of the presentation with a call to action. So really the rallying cry around why we did this report and why we do the work we do with Southwest PA schools and schools across the state is because we really believe that healthy schools are necessary. The research is clear that the quality of the learning environment can affect student health, cognition, and academic performance. Students cannot learn if they can't breathe in their buildings. Students cannot learn if they're not present in their buildings because of medical conditions. And students can't learn if they're in a building that's uninspiring, that's moldy, that's damp, that's dark, that makes it hard for them to breathe. And we know that when we make these investments, we see a difference. We know how to act on these things, on these environmental health priorities. We know how to improve the quality of the learning environment. So it's not a matter of knowledge, it's a matter of will. What are we willing to invest? We also know that healthy schools are possible. And we've seen this happen, and we've seen this happen in school districts across the state who are putting the investments in to their buildings and seeing gains in academics and student and staff health. But as a nation, we have historically underinvested in public school facilities. In fact, we don't consider public schools as priority, as infrastructure, as public infrastructure. And that means that we don't get federal dollars for our public school buildings. We now have a once in a lifetime opportunity to close the gap between the environmental quality of our school buildings. And we have the opportunity to invest in healthy schools for every child with the proposed infrastructure investment plan and the ARP ESSER funds that are now available to Pennsylvania schools. Lastly, healthy schools are what our children deserve. These are photos pre-COVID, so I just wanted to put that out there, but every child deserves to learn in a healthy school. Every child deserves to learn in a school that is temperature regulated, that's pest free, that's dry, that's safe, that's inspiring for them. At minimum, this is the thing that we can agree on, right? That this is what our children deserve, and this is what school staff and educators who spend their entire careers in these spaces, this is what they deserve. A quality environment to do their best work, to learn and to grow to their full potential. So that is the presentation part. I want to thank all you folks for listening in. We do have some time for questions, but I did want to pop our information here in case you want to have another conversation. If you're listening in from a school district or an LEA and you're going through the process of allocating your budget, you have specific questions about your building, we're happy to help and think through those issues with you in your more specific context. And I just wanted to thank you all again for taking some time to join us today. I'm going to go ahead and to be able to take some questions. So I'm just going to stop my share real quick. And if you have questions, please feel free to put them into the Q&A if you are joining us on Zoom today, or you can put them on the Facebook chat and we'll have a few minutes to address them here. Okay, so I see a few questions in the Q&A. So the first one is, are there any requirements for schools to have to take action when they find hazards? For example, if a considerable mold is found, are there any regulations for them to have to do remediation? So that is a phenomenal question. Thank you for asking that. So no, the short answer is no. So there's nothing in the state regulations that require schools to take actions. There are some things in federal regulations that require schools to take action. So it depends on the exposure, and it depends on the hazard itself. So for instance, something like asbestos, all schools that have asbestos in the building are required to have an asbestos management plan in place. That is a federal rule. The lead and paint rule is a federal rule as well. So if lead paint is found in your building, you are required to follow the repair, remediation, and repainting rule. The repair, remediation, and painting, the RRP rule, which is a federal rule for the safe way to make a space lead safe. But on a state level, if there's mold found in a school building, if there is radon found in a school building, if there's lead in drinking water, even though there's a state regulation for testing for lead in drinking water, remediation is just, you need to post a plan publicly for remediation for lead in drinking water, but it's not necessarily required. There's no fine or anything like that for schools. And so I think the biggest tool that we have is public action, and making sure that our school stakeholders are involved in this process, are aware when testing is happening in the building, and know that there is a way to follow up with school administrators and school leaders. Hey, I noticed that they were testing for mold in my building. What were the results? All of that should be transparent. We should call on our schools to be accountable to that, because it does affect the occupational hazards for school staff and educators, and it does affect a lot of students who enter the buildings, some of whom already have chronic healthcare diagnosis like asthma, and some who are hypersensitive or have immune issues as well. So I hope that answered your question, but that is an area for improvement. And one of our recommendations is that we have policies that have clear procedures that schools need to follow if the hazard is found. So schools aren't kind of going through it alone either. So the second question we have is, how can parents play a role in advocating for preventative policies and more funding to address the issues of aging school infrastructure? Another phenomenal question. I would like to say that parents, if you are a parent, if that's one of your roles in your life, if you're a caregiver to a child who attends school, if there's children you love who attend school, you have a lot of power, and your voice is so valuable. You know, these are schools are community institutions, right? They're not just a place where we send our schools to get childcare throughout the day so parents can work. They're a place where a lot of families can access essential services, right? They're a place where we can vote. They're emergency shelters. They're places where we access healthcare services. So these buildings are your buildings too. They're places where we gather, where we're in community with one another, where we cheer on our kids in sports and join PTO meetings and fundraise for issues that are important to the community. So for parents, I would say, make school buildings a part of your conversation, a part of your PTO conversation, a part of your parent-teacher conference conversation. Because teachers know, right? And all the folks who are in the building day in and day out, they know where the building needs work. And they're usually the first ones who notice when the building quality is starting to affect their health, their productivity, the way that students are in relationship with one another and with the adults in the building. And so I would really encourage parents to use your voice and use your power to speak up, attend school board meetings, learn who's making these types of decisions for your buildings, and learn to be a part of that. And also run for school board. If you are passionate about these issues, there is a way for you to stay engaged in them and to call for accountability and transparency in the process of it. Because this is, again, goes back to that last point, that healthy schools are what our students and staff and our families deserve. And that is a shared goal for all of us. I don't think there's anyone who disagrees with that. So we just have to make sure we keep the pressure on our schools to think about, if we are going to spend dollars on our buildings, let's make sure we're spending it on long-term investments, and then things that will have a lasting impact. And then maybe the last thing is write to your state legislators and ask them to fund public school buildings, because our neighbor states, Maryland, West Virginia, New Jersey, they've all found a way to find sustainable funding for their public school buildings. They've all had the political will to make that investment. And so I would encourage, getting to know who your state legislators are, who those decision makers are at the state level, and how you can get them involved in this conversation. Let me just check to see if there are other questions. If you have other questions, folks, feel free to put them in the Q&A. I'm just gonna hop onto Facebook really quick and see if there's anything listed there. Did you look at the use of different cleaning products and the impact on children's health too? Have schools rolled out green cleaning policies? Awesome question. Yes, we did look. We have a huge spreadsheet where we ask schools in the most recent school year, please send us all the chemicals you have purchased for cleaning and disinfecting. And so we are able to really take a deep dive on green cleaning. And what we found was actually pretty exciting because in Southwest PA, what we found is that we actually saw a decrease in the total number of products. So the average number of cleaning products a district in Southwest PA would purchase in the 2018 data set was 25. This round, when we did it, those same set of schools now purchase an average of 14. And I think that really speaks to a change in the culture of cleaning and disinfecting, where what we're trying to find are really effective, safe, and non-harmful chemicals to clean and disinfect. Because it is possible to clean a school building with just 3 chemicals. Pittsburgh Public Schools cleans with just 10 chemicals. And so there's ways that green cleaning can be rolled out that's 1, cost effective, 2, the chemicals themselves are super effective for the needs of schools. And 3, it's easier to protect against the hazards of, because all those chemical products produce air pollutants, right? They're VOCs, they off gas, they have a smell to them. And any product like that will increase the amount of indoor pollution you have that's being created inside the building. We found that most of the schools in our statewide survey have at least 1 product that is third-party certified as a green cleaning product. So that means it's tested to make sure that the effects on human health and the effects on the environment are really minimal. And so that's really wonderful that 85% of the schools in our sample are taking that positive step. There's a few schools who have green cleaning policies and who've actually reported seeing decreased absenteeism for staff, for custodial staff, teaching staff, and for students. And so that's a wonderful outcome that we are able to kind of capture in this process. And we hope as we keep doing this process, we see more positive changes like that. But green cleaning is an awesome way to address infection prevention, right? So one of the reasons we clean is to remove viral load, active viruses from surfaces. But the other reason we clean is because it's a public health practice, right? There's lots of people using the building. There's lots of people in and out. And we want to make sure that that is really the first line of defense, when we're thinking about a healthy environment. And so it's really positive that we were able to track that change over time. And it seems like schools are going in that direction. I believe there was a green cleaning bill at the state level that was proposed, but I don't think it ever left the education committee. And so there are some people, decision makers, who are interested in making this change and supporting schools to do it. And we do have some champions here across the state who have adopted those programs who we can learn from. Thanks for that awesome question. Yeah, so we have a few minutes left. I'm just going to do another quick look at Facebook to see if we have any other questions. But if not, we can go ahead and close this out. I'm just gonna give me 1 more minute to take a look. Okay. Well, if you have additional questions that you would like to have answered, if you are a school board member, a school stakeholder in any way, a teacher, a school nurse, a school administrator, someone who just loves schools and is an active member of your school community, we'd love to stay connected and talk through these issues. There's a lot right now that schools are making decisions on. And the other pillars of the ARP, learning loss and tech infrastructure, are so important. But I think if your school is in a place where you are considering using some of those ESSER funds for school infrastructure, I think those dollars, there can be a strategic way for us to use those dollars so we get the most gains and the most positive impact in student and staff health and academic potential. So I hope that this gets you excited for the upcoming report. We have a lot more data stories to tell about schools across the region, schools across the state, and the regional disparities that exist between them. And there's a lot of awesome information and action that we can keep taking to stay engaged in these issues. So I wanted to thank, oh, sorry, thanks, Nathan. So I just wanted to close this out and thank everyone for taking the time to join us. This was, I believe, going to live as a recording. And so if there were things that you missed, if you joined late, you can always go back and review. And if you want to stay in touch, please feel free to say hi in the chat or say hi on our Facebook page. And we're happy to reach out and help us think about how we can achieve healthier schools for all of our kids. Thanks all. Have a good day. We'll talk soon.